Hello, everybody. This is episode 70 of our podcast, Artificial Intelligence and Cybersurgery. It is the official podcast of our journal, Artificial Intelligence Surgery. I think, Vincent, we should mention more often that we have an impact factor official of 3.6. And Vincent, Dr. Grasso will introduce our next guest. So take it away. He's a good friend of mine.
Sure, this is exciting. I think it's one of our few podcasts with distinguished South American surgeons. We have Dr. Nestor Gomez, who's a gastrointestinal surgeon working out of the Kennedy Hospital system in Ecuador, and we have one of his students that went on to become a robotic surgeon, Dr. Stanley Jama. He's at the University Hospital in Guayaquil. He's the chief of surgery there, and it's a great pleasure and honor to have you on our 70th podcast. Welcome, professors.
Oh, and Vincent, before they start, please say our catchphrase, because I think I forgot to say it.
And we are the only journal dedicated to all things AI.
And surgery.
And surgery, of course.
So I know Nestor. Nestor, how many years have I known you now?
Oh, it's before COVID. That's about 8 years. Can be 8 years. Oh, then I was there in the Leon Becerra.
Yeah.
But now I have a new goal. You will know afterwards. A new goal that is very interesting. I'm working 15 years in that goal, you know?
Yeah.
But the difficulties and all the things here and the governments, all the things is trying to rest a little bit.
You know, I'm trying to remember when we went to the Galapagos.
Oh, yes.
That was
you were the best runner there. You were the best runner there, yeah. On the beach.
Yeah. What year was that? Oh my goodness. That was
that was approximately 2010, 2011 already.
Yeah, I'm going to look right now. Galapagos. That was in 2013.
2 years I made a mistake, eh?
Yeah, because I think you went to the Galapagos maybe 2011 the first time, right?
Yes, was my second time, but as congressman, my second time.
Yeah.
And I remember very well when we worked in Leon Becerra in a mission, you came, and the guys with all the pancreatic surgeons, and we went to our farm, and then you run, and then went to the river, you swam, and then you return, and you have a massage at home.
Oh, that was amazing. I remember so Vincent, he took us after we did this mission, he took us behind he has a ranch out in the mountains. And so we had to walk through the banana fields, but the only way we could do that was with a machete. So
yellow boots.
Yeah, yellow boots.
Nice.
Yeah, it was surreal.
Let's go.
Yeah. So Nestor, before we talk more about that, can you remind us, you know, I know you went to Germany for a time, but you initially did your training in Ecuador, and then you decided to train with some, where did you train in Germany again?
In Göttingen University Hospital.
Yes. And who did you train with?
I trained with Professor Piper and Professor Sievert.
Exactly.
Both are top.
Right. So you know that you remember the C word classifications, Vincent, for lower gastroesophageal cancer. So it's amazing to me that you worked with the C word. That's amazing. And you were in Germany for how many years?
4 years.
Amazing. And how did you learn German?
I learned German here a little bit, and when we went to Germany, the program of the Germans was that I have to be so good in German that I have to stay in a little town of 25,000 people, a very touristic place, that's the name is Rottenborough of the Tower. I recommend to know it.
Wow.
It's fantastic.
How long were you there?
Approximately 6 months.
Wow. With nobody spoke any other language besides German?
Only German.
That is the best way to learn. That is amazing. What a smart thing for him to do.
Yeah. Really, I am grateful and thankful about that attitude, especially Siever, for example. Siever was a very strict professor,
Yeah.
but I received a satisfied when he decided to write with his letter the recommendation of my book, my surgery book.
Yes.
And I was very, very proud when I knew that he was dying.
Yeah.
He was strict, but I am very thankful about that.
I bet. And so that I can only imagine what it's like to work with one of one of the giants, one of the true giants.
Yeah.
So when did you consider staying in Germany?
Did you consider what?
Did you consider to stay in Germany?
Yes, about 10 times.
Yeah.
But when you love your country, you have to decide, or you stay here, or you love your country. And then I decide by the second one.
Yes, I understand. And then now you're originally from Guayaquil?
Yeah, I was born here.
Yeah.
And I am very grateful from my country. She has been so nice with me, and what can I say? I'm thankful about it.
That reminds me, Nestor, one of the times when I went to visit you in Ecuador, we went to a soccer game.
Yes, sir.
What was the name of the team?
Emelec.
Emelec. Oh my God.
Don't say too loud because my good friend Stanley will be mad because he's Barcelona.
He's Barcelona. I tell you, Vincent, you've never seen anything like it because the fans, they run up and down like the whole. Can you imagine like the whole wall of the stadium where the fans are run up and down like 10 or 15 rows at a time? Like imagine like 10,000 people running up and down. And then when they just start lighting fire, it was just a wall of fire. I've never seen anything like it. And I've seen games in Italy. I've seen games in Brazil, but I mean Ecuador blew my mind.
Now we have a player there in PSG in Paris. Pacho. And we have a world championship in Chelsea that is Cheo, and he plays very well. He's fantastic.
Yeah.
So you see, Stanley is mad because I mentioned Emelec.
Yeah, Stanley, I have to put you on mute because we hear other noise. Can you tell the people around you to be quiet so I can take you off mute? Okay.
Que si tienes alrededor a alguien, dice, está haciendo bulla.
Yeah. Okay, perfect. So Nestor, so you go back to Guayaquil and then you did you start working at Leon Becerra right away or?
No.
Wait,
my proper hospital where I worked when I was a student there. I went there when I was in the first year to all the emergency department and learned. So that the name is Hospital Luis Bernaza. And I made my internship in the hospital where Dr. Jama is the chief of surgery. So I made there my free internship that was surgery, clinics, and gynecology. And then I went to another hospital to make pediatric training.
So, one of the things I always respected about you, Nestor, is that you were really a man ahead of your time in the sense that you started doing endoscopy very early.
Yes.
And I keep trying to, in France, the surgeons have no training in flexible endoscopy. And I think it's very important for the future of surgeons that they need to do flexible endoscopy. When did you start to do endoscopy? Did you start to do it in Germany or did you start to do it in Ecuador, and why?
No, my history is this one. My Ecuadorian professor, Dr. Dakach, father, because the son is Dr. too, is a good friend of mine. He made his training in St. Mark's, London, in coloproctology surgery. But he made gastroenterological surgery. And I learned that a lot, really a lot. That was the reason that I forgot to say both, that when I was in my training in Germany, my coloproctological trainer was a surgeon that has been in St. Mark's. So Professor Piper decided that I have to go to St. Mark's. I was part of a training. It was about 4 months or something like that, because I have a lot of learning of my professor here. And really, I see the great advantage to be a surgeon that came from a gastroenterological unit in a great hospital of a university as Göttingen. So I was the first assistant to all the surgeons there in St. Mark's.
Right.
The time that I left there, inclusive, I arrived to Ecuador smoking pipe.
like them, yeah.
Our chief was 10:30. He said, "Okay, it's time of tea," and he take out the pipe and hell. So good times. I learned a lot, really.
Yeah, I bet. So you were doing flexible endoscopy already in Germany. You're doing colonoscopy?
Yes, but colonoscopy I made more in Germany.
More in Germany.
Germany. I made a lot of work, and really,
Right.
I was surprised the other day when we were speaking with Stanley too, that I'm surprised I have 7 books.
Yeah.
And have one for endoscopy, one from HIV and gastroenterology, and the last one was a big test that Seaver sent the recommendation words.
Right.
Was
You did the dedication. Yeah.
a dedication, right?
Yeah.
That was a nice dedication.
Right.
You know, Seaver was a Sir Hart professor without saying a word. Without saying a word.
Yeah.
One day, in my first month, second month, he said, Dr. Gomez, I received that you have to be training in writing papers and all the things, but we have 60 days here and you didn't visit my office. Oh, all the people get nervous when Seaver speak like that. So I went to the office and he said, "Here is this work. Review it. If you find a wrong thing, tell me."
Yeah.
But he was sure that was all okay.
Yeah.
So I found a mistake
Yeah.
and say, "Professor Seaver, you are right. Say nice work, but here is a thing that is not okay. What's it? This. Mhm. Tell my secretary to fix that." From then on,
Yeah.
I received all the kindly and friendly training.
Yes, yes.
You see how we were when he was here in Guayaquil. Remember?
Yeah.
And in one ACS Congress, you were introduced by me to him.
Yeah.
You want to know him.
Yeah.
It was fantastic for esophageal surgery.
Of course. Yeah. No, you know, just giant among men, of course.
And they were good partners with Nissan.
Yeah.
So I know very well that, and he put my dedication, my book.
No, it's
So
incredible
so
honor. Yeah. So
yes.
how do people learn endoscopy in Ecuador? Is it required or is it special training?
No.
You have gastroenterologists who do most of it? How does it work there?
No. There are gastroenterologists that make that work, but the surgeon who is training, as my case, has to do it. You know what you are going to operate.
So what percentage of gastrointestinal surgeons know how to do flexible endoscopy in Ecuador, do you think?
I think it's not so high.
Okay. So
we can say 30-40%. I don't know. Stanley can say about his hospital right now, but in that case, there was afterwards there was a society, and all over the world, and I became a honorific member of SAGES, Society American Gastroenterological Endoscopic Surgeons. And it's very nice. It's a very nice society.
Yeah, no, of course. It's probably the best one in the United States by far. Stanley, ¿haces endoscopía flexible? Colonoscopía, endoscopia. Okay.
Colonoscopia, endoscopía alta, digestiva alta y endoscopía y colonoscopía gracias al profesor Gómez.
He made me my endoscopy.
Con Dr. Gómez.
¿Cómo? ¿Todos tus residentes aprenden endoscopía?
No, solo dentro del programa está cirugía laparoscópica.
Ok.
Mi objetivo sí es ingresar un endoscopio al quirófano, es parte de mi visión para enseñar endoscopía.
Nice.
Pero no está dentro del programa.
Ok. No es obligatoria.
No.
Oh, okay.
But Stanley made me the endoscopy, you know?
Yeah? No?
Yeah.
Tell me what?
Yeah.
Yeah.
Explain. What do you mean?
He made me personal endoscopy.
Oh, he did it on you. Oh.
Yeah.
Okay. Woo. Okay. Stress. ¿Qué stress? Ay.
Very stress.
¿Los residentes piden aprenderlo, Stanley?
Sí.
Okay,
algunos.
Okay.
Algunos.
La mayor parte, no, muchos, no
La
muchos.
mayor parte no.
La mayor parte.
Pocos se interesan.
Yeah. So I mean, Vincent, you know, as you can imagine, you've been to Peru. I believe you've been to Bolivia. We obviously know that there's a limited amount of surgeons around the world. You know, surgeons in South America, around the world, need to know how to do flexible endoscopy. Probably surgeons in the rest of the world are going to need to do more flexible endoscopy because artificial intelligence is enabling more autonomous actions. It's going to enable, you know, more and more things done through natural orifices and what have you. How do you see really the future of endoscopy in places like South America? I mean, it really seems like it's going to have to be. It's a huge necessity. We do not have enough endoscopists to do it, and AI could really fill that gap. How do you see that that's going to play out? Do we need industry to put in money for training into developing of these autonomous endoscopes or like more autonomous endoscopes? Do we need governments to do it? How do you think realistically we're going to get there? I know it's a tough question, but that's what you're here for, Vincent.
No, it's exciting. I mean, I did a lot of early laparoscopic training in Bolivia and realized the challenges that they had. The surgeons were very, very well trained, but it was hard to get equipment. So we donated laparoscopic towers and a lot of instruments. Part of the challenge, Andrew, was we trained the guys and donated the laparoscope and donated the towers, but they didn't have funding to buy staplers and all the accoutrements that you need, right? You know, you need to buy consumables. If you don't have budget for it, you have a camera, insufflator, monitor, and no you don't have the consumables. So that was it's obvious now, but in hindsight, we didn't think of that. I'm excited for the simulators to help the students learn how to make the correct moves with endoscopy and colonoscopy. And that's, something that we could help with in more affluent countries, helping with AI simulators to get the students and the residents going. And then working together, perhaps doing tactical donations, not just blanket throwing money around, but really setting up sustainable programs. And sustainability is the key thing, because you can donate all sorts of equipment, but if you don't have the follow-up with the consumables, then everybody just has fancy equipment in a room that never gets used.
While you're talking, Vincent, you reminded me of the issue of remote surgery, right?
Yeah.
So as we know, Stanley is doing a lot of robotic surgery now. And so I'm going to ask you and Stanley this question. Stanley, ¿estaría interesado en recibir apoyo para cirugía robótica remota? ¿Sabes qué es cirugía remota?
Sí, yes. Escuchamos tú en cirugías realizadas remotamente de las noticias y nos parece interesante.
¿Sería valioso para usted?
Yes, porque yo llevo un programa de residente de posgrado.
Sí.
Coordinador. Universidad Espíritu Santo. Residentes de posgrado.
¿Tú gustaría que un médico extranjero te ayude durante la cirugía?
Yes, sí, porque nosotros llevamos años, 3 meses y hemos hecho cierto tipo de cirugía, un poco de dificultad a veces en el docking de la cirugía de pared abdominal.
So Nestor, I got into trouble one day at a conference because let's just say when I first heard about remote surgery, the thought of doctors in North America, in Europe, in the thought of big companies spending to make all these networks so that surgeons in America could help do surgery in Africa and South America on patients. My initial thought was, what an enormous waste of money that is. Maybe we should train more doctors, et cetera. But, when you talk to someone like Stanley, who I'm sure would love to do more complicated surgery, who's already doing robotic surgery, he would love something like that. So who's right? Was my initial reaction fair? Is it a waste of money, or is it not a waste of money? Is remote surgery, you've been to Germany, you've traveled all around, you learned in Europe, and then you came back to your country to train more people. What is the best way forward? Because I don't really know the answer, but I'm much more open to the idea of remote surgery than I was when I first heard about it.
I will tell you an old story from my side, and I congratulate Stanley when he invited me to see the robotic surgery, and he became surgeon because his decision to obtain the robotic apparatus from our capital. That's our internal competency between Guayaquil and Quito. When Stanley took this decision, they brought a equipment from one of 4 equipments that Quito has in their hospitals. But you will be surprised for what I would tell you right now. You know how many operations they made during 12 years? Null. 0. And right now, as I know very well, Stanley say that they are over 60 or 80 or 100 like that. So that competition between the 2 cities are very harmful. And right now, I didn't say you a thing because about 15 years ago, I decided to put a institute of our foundation. And we bought a place that right now costs about 1,400,000, and the directors of this residency village decide that they don't want to have a hospital there. And right now, I want to install the new place where we can give support to poor people with a low rate and training for young people to make endoscopy if they are surgeons or if they are clinicians. You see? And we are right now looking for a place that we can interchange that place that has to be from a building there or something like that. But right now, the 2 members that they say they don't want to have that about 15 years or more, I say, okay, if you're single, you are all right. And now I have to be sincere. They had right. Because right now it's so big, the place with village and all those things, that they will not permit the poor people to get into that hospital. You understand? And right now that here the things are changing, and we have to be care. I am trying to move and sell that place to this money, buy a place where we can put units of endoscopy and all those things. And
no, I understand. I mean, money is still a huge problem. You know, what Stanley wants and needs to push the robotic program is valid. And I understand why he wants assistance.
I think so.
But then we don't have money to treat people for simple things. You know, it's like that's the thing. Both things can be true at the same time. That's you know, that's the reality. So Vincent, we only have about 3 minutes left. So why don't you give us your final comments on kind of what you're thinking about some of the topics that we discussed here?
Well, I think you have 2 surgeons with great backgrounds, clinical competency, experience, and they've got their pulse of what's going on in their community. And you're right, Andrew. It's a blending of sophisticated technologies like we're accustomed to, but you can't leave the basics behind. So if you don't have proper endoscopy, colonoscopy, if you're not able to treat basic bread and butter surgery, then more people are harmed than once in a while doing a more sophisticated robotic surgery. That's nice, but you got to have the whole thing. They, like you said, they both are true, and you've got to plan on having the whole spectrum. Or, you know, people that need breast biopsies don't get them done, right? So it's kind of a difficult space, but I think maybe we can be helpful, at least with some of the technology and AI stuff we're working on, to see if we can, you know, help the guys down in their hospital system in Guayaquil. That'd be an exciting project to talk about.
Yes, sir.
So
if you permit 2 minutes to say something, I will be glad to inform you.
We have a little bit less than 2 minutes, Nestor. So
Okay, I will be ready. When I left the hospital, Luis Bernas and Luis Becerra, I spoke before with a administrative doctor in Miami, and she was telling me that the residents doesn't know about the Latin American diseases. So I decided, and I said, what about if you buy the hospital? So the day when I renounced to be in the Luis Becerra Hospital, she called me that they were ready to buy it. I know right now that the hospital is not so good in economic situation. I will see if we can make a center where there can be this incredible system.
Wow.
wow.
By my side, I am very happy to speak with both. Now a good friend of mine too is Chris, right? The name, and I decide to say thank you to all your gentility. I looked at artificial intelligence to see how far we'll go, because it seems that the frontiers are very, very big.
Very advanced. Nestor, we have about 30 seconds left. So clearly we have to do this again, probably sooner rather than later. It is wonderful to see you, Nestor, and you, Stanley. I look forward to seeing you in May, but maybe we can talk about synergies sooner than that. Okay.
We are speaking to have you both here. So I spoke with laboratories to support your travel here.
Great. Bye, everybody.
Bye.
Everyone.
Take your time.
Thanks, Stanley. Take care, Nestor.